Hi, my name is Dr. Karl Yousef, and I'm here to break down what to expect in the emergency department when you come in with a headache. I'll walk you through certain things your doctor may be thinking about, and afterwards, I'll explain certain labs or imaging that you might receive. Depending on the complaint, we'll finish with some potential outcomes to expect if your doctor sends you home. Now remember, in the emergency department, we don't just look for what is going on, we look for what isn't going on. What does this mean? It means that as emergency doctors, we always have a mental list of scary diagnoses that we have to make sure are not happening to you. So, even if we don't find the exact diagnosis within one ER visit, our goal is always to rule out big, bad, and scary things. As you go through your workup, remember that even if you don't see your doctor for some time, they are always following your results in the background. So, you're coming into the emergency room with a headache. Here is what your doctor is thinking. First thing is, could it be a stroke? This can be ischemic, meaning loss of blood flow to the brain, or hemorrhagic, meaning there's bleeding within the brain. This can happen if you've experienced trauma, especially if you're on blood thinners, or if you have a ruptured vessel in the brain, which can be due to long-standing hypertension or blood vessel disease. I'm not trying to scare you, but these are things your doctor is always thinking about. Your doctor is also considering tumors and anything else in the brain that can cause increased pressure. Remember, the intracranial space, this means the space inside your head, only has three major components. These are your brain tissue, your blood supply, and a watery substance called CSF, which stands for cerebrospinal fluid. Besides that, there isn't much room in there for anything else, so any bleeding can quickly cause a sensation of increased pressure. Next, your doctor is considering any infections that could be causing this headache. These can be dangerous bacterial infections or certain viral infections. These can affect just the brain, causing a process called encephalitis, or can even affect the layers above the brain in a process called meningitis. However, the diagnoses mentioned above are rare causes. Other more common and less dangerous diagnoses include a simple virus running through your body, a classic migraine, or even electrolyte issues. As a special note, various other things can cause headaches, even environmental factors like carbon monoxide poisoning. Definitely something to consider if you're being exposed to gas heaters or exhaust fumes. Also, being out in the sun and heat can cause headaches in a process called heat exhaustion or heat stroke. To add a little more confusion, even pain from your eyes, neck, jaw, or other body parts can be causing your headache. Since this is a very variable complaint, your doctor will speak with you and examine you. This may often include a neurological exam. Afterwards, depending on your doctor's assessment, you may get blood work to check for infections, blood loss, or electrolyte issues. You may also get a CT scan of your head to check for bleeding or masses in the brain. Now remember, this is not always necessary and is up to your doctor. Keep in mind, a normal CT scan does not rule out an early stroke. This is oftentimes a clinical diagnosis, meaning it is based on your doctor's suspicion. Your doctor may also give you medications to help decrease your headache while you're in the emergency room. Finally, if your symptoms improve and you're being sent home, I'm happy to hear that. Make sure to follow your doctor's recommendations, and if your symptoms are not improving or are getting worse at home, we always encourage you to come back to the emergency department to make sure nothing was missed on the first visit. I know that being in the emergency department can be an incredibly stressful experience, and I hope this has been helpful for you. Again, this is Dr. Karl Yousef, and wherever you are, we care about you. We work hard to make sure that you're okay. While you wait, Feel free to subscribe to this channel for more medical information from a board-certified emergency doctor. You can comment with video ideas that you want me to cover, and I'll take the time to reply to you. You can even watch some of the other videos on this channel for entertainment. Thank you for your time. I'm wishing you the best in your health.